Welcome everyone. My name again is Shayna Jacques. I'm from PSS or Cove Care. Today we're having a webinar about the new direction and treatment for Alzheimer's and dementia. And our presenter is Dr. Adam Smith from Richmond Behavioral Associate. Probably many of you know about our agency already, but a little bit review about PSS. PSS has been founded in 1962, is a multi-service agency that has for mission to strengthen the capacity of all the New Yorkers and with their family and community to thrive. We offer online educational program like today's webinar, other activities that can help the older adult to stay healthy, engaged, and connected. We also have senior centers located in Upper Manhattan and the Bronx. We offer services for caregivers towards the five borough. If you want to know more about our services, please reach out to our website. It's pssusa.org, and we can have more information about it. Again, today we have Dr. Smith with us. A little bit rule about the webinar today. If you have any question, you can post it on the Q&A box. And we're going to wait at the end of the presentation to answer all the questions. I can read them for him. That will be easier, that you can answer it. Okay, and also the webinar will be posted on our website. If you missed something or if you want to see it again, you can go back to our website and then see it. Dr. Smith, are you with us?
Yes, I am.
Okay, so I'm gonna give you the site. So I'm gonna stop sharing and you can share your page.
Okay, great. Thanks. So I'm Dr. Adam Smith. I'm a psychologist and I am a partner in Richmond Behavioral Associates or the Advanced Memory Institute. I imagine that I'm speaking to people from all over the metropolitan New York area. My office is physically located in Staten Island, one of the outer boroughs. So if people want to contact me about anything I'm talking about today, my last slide will provide my contact information. We are a clinical center that works with a variety of aged patients, but we do focus on memory disorders, Alzheimer's, and related dementias. In addition to seeing clinical patients, we do a lot of clinical research, and that research aims to find newer and better treatments for dementias, most often Alzheimer's disease, which is the most common kind of dementia. And we work on both the cognitive, which are the memory problems of Alzheimer's disease, but also the behavioral problems that often can occur in moderate and severe stages of the illness. And by behavioral problems, not only do I mean depression, but a lot of the anger, upset, sundowning, where patients or people with Alzheimer's may become disoriented in the evening and more reactive and angry. So, our research aims to provide better treatments to manage the whole of the patient. So both their memory and for behavioral problems as well. Today, I'm going to talk about some of the research that's going on. I'm going to try not to bore you with too extensive a lecture, but what I will do is talk about a group that I'm working with, or the GAP organization, and it's an consortium of 71 sites around the country, and its GAP stands for Global Alzheimer's Platform Foundation. And in addition to the research I'm doing, we're working with them on disseminating information about Alzheimer's disease and aging and memory, and try and provide tips and information to people so that their aging process with respect to memory can be as healthy as possible. So in addition to talking about healthy aging and brain function, I will be available at the end of this call to take any questions that people have about anything I've talked about with respect to healthy aging, brain aging, but also any clinical trials that patients or their families might be interested in participating in. I can let you know where some of these clinical trials are going on and the kinds of projects that they're, in terms of the kind of symptoms and issues that they're focusing on with respect to dementia. So with that being said, I'm going to start out and just talk about this brain health initiative. And in addition to hopefully preventing Alzheimer's disease, although these steps aren't, there is no way to prevent the illness certainly completely, there are things that we can all do behaviorally to promote healthy aging of the brain. Once people have an illness, these kinds of behaviors and steps still have a lot of value, but obviously other medical testing and treatments need to occur. So what I will say about this Healthy Brain Project is that negative brain aging is related to lifestyle choices and chronic diseases such as heart disease and diabetes. So one of the initial points I'm going to try and raise for people is think about healthy aging and healthy brain aging as also the appropriate things to do for general health purposes. So we have to understand that chronic health problems not only affect many disease organs in the body, but also impacts brain function as well. So the good news is we try to take steps earlier, and it's never too early or late to start to try and maintain good health and age more efficiently. With respect to dementia and general brain aging, there are new theories that suggest that a lot of the pathology that occurs is similar to heart disease. So people just don't wake up one day, for instance, with a heart attack, but all the plaque and all the disease processes that are going on that lead up to that heart attack have occurred over a long period of time prior to that specific event. And we're thinking the same thing is true now of Alzheimer's disease and brain disease, that we have to start thinking about living more healthy lifestyles and doing certain things for the years certainly prior to our advanced aging, so that we can prevent some of these problems from developing. So the whole idea is that, if you have a heart attack, some of the behaviors that you engaged in for 10, 20 years before that heart attack have contributed. And we're thinking similar things are going on with brain health. So let's go to the next slide finally. Okay, let's see. All right, what is brain health? So brain health refers to the ability to remember, learn, play, concentrate, and maintain a clear, active mind. It means that you're able to draw on the strengths of your brain, to approach new situations, to be able to think your way through the situations, to exert logic and good judgment, and then also reflect back on all the previous learning that you had to help you make better decisions. So you want to do all that you can to maintain all the lifelong learning that you want to continue, so that you can use that learning to basically enjoy your life, engage in leisure activities, be social, and everything that we're talking about here really tries to, has been shown and associated with maintaining brain health. And it doesn't matter how old or young you are, it's important that people sort of start at some point. So we want to think about, how do I achieve it? It's every day making positive lifestyle choices that lead towards healthy brain living. Okay? It's not something that you do for a week and think that you've sort of made a significant change in your risk factors. It's something that has to be done continually over time. So there are 8 general pillars that we talk about in terms of maintaining brain health: staying active, eating well, sleeping well, exercising your brain. And I'm going to talk about that because people often have very different ideas about what it means to exercise your brain. Connect with family and friends. Socialization has shown to be tremendously important in maintaining brain health. There's the associated relaxation and reducing stress, usually easier said than done, but we'll talk about that, and then managing other risk factors. The other thing is, get involved in research. As I indicated earlier, I'm a clinical researcher, and when we're trying to find cures or treatment for diseases, it's much easier to treat patients that are very early on in the stage of having a problem. Like other diseases, if you have advanced heart disease or a stage 3 or 4 cancer, a lot of treatments can't be particularly effective. But if those same interventions are done at a precancerous early stage or stage 1, you have a much better likelihood of having a good outcome. So if people are affected with any sort of dementia or Alzheimer's disease, getting involved in clinical trials is an excellent way to get access to the latest treatments available. There are some approved FDA treatments that have been around for years, and I can talk about those later, but clinical research can offer additional benefits over those. So let's dive right into the staying active pillar of brain health. All right, well, the picture says 1,000 words, but what does that actually mean? It's important to exercise in a way that is relatively vigorous. Look, walking is an acceptable vigorous activity, but one has to obviously take any intensity of exercise that they might be considering, and please discuss it with your physician and in light of whatever medical conditions that you might have, because people do have vulnerabilities based on certain medical problems. But it is important to have an aerobic activity, something that actually gets the heart rate up. So if you are walking, to walk at a brisk pace. Some people enjoy cycling, jogging, or swimming. All good, purposeful exercise modalities. And what that means is that these are things that we take time out of our day to do. So they're purposeful, okay? And we want to basically differentiate that from staying active through an active lifestyle. And what that means is we're incorporating general activity into our daily routines. And you can see from this chart, examples of this are walking to work instead of driving. Or if you do drive somewhere, that you don't park at the closest possible spot, that you might park a little bit further away and walk. Taking the stairs instead of an elevator. And engage in sort of hobbies and sports or activities that just sort of keep you moving. A sedentary lifestyle is not one that is consistent with good, healthy brain aging. So it's sort of a two-part focus. Find some exercise that works well for you, that you enjoy, that is relatively vigorous, but don't forget about the other part of your life, so that if you're exercising for 45 minutes a day, don't forget the other 23 hours, of which you're probably sleeping 8. But of those 15 hours, think about what you can do in your daily life to increase your general activity level through other means. Again, by walking instead of driving, taking stairs instead of elevators, things along those lines. So that's the first pillar, activity. Eating well. General nutritional benefits we are well aware of with respect to cardiovascular disease. There is a big relationship between heart health and brain health. So I'm not a nutritionist, but we have some lists here of what to eat and what not to eat. There's evidence that that flavonoid-rich foods may be capable of preventing many forms of cerebrovascular disease. So cardiovascular is the heart, cerebrovascular is the brain. So eating flavonoid-rich foods may be helpful in preventing cerebrovascular disease. And what we mean by that is stroke or transient ischemic attacks. So just like there are blocks that occur in people's heart arteries, similar things can happen in the brain. So a diet can be helpful to reduce the amount of disease that might occur in the brain. So flavonoids come from citrus, berries, and apples. And there's been some evidence that they appear to change the structure of neural pathways in the human brain by basically increasing the efficiency of blood-brain flow. So the more blood can flow, just like in the heart, it's more likely to bring oxygenation and health to the surrounding tissue. So that's really important. This in turn creates healthier brain functioning in areas of storing, processing, and retrieving information. And this general preventional strategy helps the structural prevention of structural decline and maintains the body's ability or the brain's ability to process sensory information. Okay, you can look at some of these foods that I've mentioned that have flavonoids. Obviously, it's just as important to know what we should eat. It's also important what not to eat. And we're all human. We all have lives, but the point is to really minimize fast foods, sugary drinks, white flours, a lot of carbs, excessive alcohol, processed foods, too much sugar, and real fatty foods. Some of that's part of a diet that's acceptable, but it really should be avoided in more than small ways. So we all have foods and we're all in situations where these things are difficult to avoid, but it's just important to minimize. Let's go to sleeping. Well, what does this say? Sleeping well is important to overall brain health. There's a lot of restorative function that occurs when people sleep, and to maintain and reduce problems associated with brain aging, limit daytime naps. When people nap too much, it definitely interferes with their ability to have good, consistent sleep at night. So in order to adhere to sort of good sleep hygiene and to sleep better at night, it's obvious you want to avoid things like caffeine and nicotine close to bedtime. Exercising during the day is good to promote good quality sleep. It's interesting, back when I did my dissertation 20 plus years ago, I did a study with people over 55, or actually I think over 65, and we had them exercise during the day, and it definitely did improve their sleep at night. The thing you should know is it is not helpful, and it can have a negative effect if you exercise close to sleep time, because you'll be more activated. So if you do exercise, it's important to be able to do that during the day to give your body an opportunity to settle down, so that you can initiate a good quality sleep. So again, steer clear of food that might be disruptive right before sleep. Obviously, there are people that have reflux, especially as they age, and so you want to be aware of foods that can be disruptive and cause discomfort, which interferes with sleep. You want to have adequate exposure to natural light during the day. Obviously, there's a lot of discussion today about vitamin D3, and a lot of physicians now even are testing for that. In order to fall asleep, ensure a relaxing bedtime routine and make sure that the sleep environment is pleasant in terms of being quiet. It's not associated with other activities that you find stressful, like doing your bills in your bedroom, things like that. So you also want to, obviously think about the actual sleep environment in terms of the temperature of the room, having a good mattress, pillow, dark curtains, so that you aren't too sensitive to any light that might occur outside. Sometimes if people are in a noisy environment, having a white noise machine is good. And for some people, they find some benefit from aromatherapy and having oil diffusers and things like that that produce relaxing smells in their bedroom, all helpful. So exercising of the brain. We talked about this, or at least I mentioned it earlier, and here's a slide that talks about some of the things that people can do. And I'll go through a little bit more specifically about this. Excuse me one second. So it's important that that people do the kinds of things that help activate their brain. And I'm going to get into this whole idea of socialization and why that's important. But even solitary activities or things that engage your brain are important. Tutoring, reading, art, music, games, trivia, meditation, all these things are helpful. I know that there are a number of new apps and computer programs that are available that facilitate or try and help people exercise their brains. You want to keep your mind thinking all the time. You want to keep your brain trying to learn new things. So some people will also do things like, oops, I want to go back. Puzzles, learn a new language, volunteering, anything where you're learning something new, where you're exercising and sort of stretching your cognitive function. It's a good thing. It provides the opportunity for information retrieval. So it helps for people to then be able to facilitate memory and recall. And it basically keeps your cognitive reserve, meaning that the more you exercise your brain, the more you're allowing for your brain to function optimally so that it's available and used to sort of thinking and executing certain brain functions. So let's go on to connecting with family and friends. So that's the whole issue related to socialization. And there have been a number of studies that have come out that have shown that social activity is critically important. Sometimes people, just going back to the last discussion about exercising their brain, I got to make a comment. Watching TV is not exercising your brain. You're just assimilating. You're a passive observer of whatever you're viewing, and it doesn't provide activation of brain function. Socialization is very effective at doing that. You might not think that talking to somebody, going out to lunch with someone, or playing cards with someone is something that is particularly helpful to brain function, but it is very important. There is a lot that goes on in social interaction that activates brain function. We have to look at people's faces. We have to understand the words that they say. We have to understand the context of those words. We have to understand people's inflections. We have to try and understand their mood. There's a number of complex things that go on when you're interacting with people. And increasing social activity and having these social interactions has been shown to be to link to a lower rate of cognitive decline. And for patients even that have illness, the first thing that we do is refer these people to day programs and other social programs, and it makes a tremendous difference. And the data has borne that out to a great extent. It's also been shown that people with more social contacts score higher on tests of memory and executive functioning. Executive functioning means those cognitive processes that help you plan, organize, and complete tasks. Positive, healthy interactions and relationship also show a greater benefit, obviously, than stressful, negative ones do. So if you have a chance between somebody that makes you feel good and somebody that sort of aggravates you, obviously we know which person you should pick. Look, and I know it's also hard as people get older. A lot of their social contacts have either moved away. Some have gotten chronic illnesses where they can't come out and interact. Some have passed away. And there's a lot of isolation that goes on with the elderly, and maybe because they have other, physical limitations as well. So it is important to sort of look at what avenues are open to you to provide for new opportunities for socialization. It's something that is probably a lot more work for older folks because they are in situations where they don't have those social outlets. but there are opportunities in the community, either through volunteer work, classes, uh, senior centers. I mean, there's a number of opportunities. Uh, as I already talked about, we all tend to isolate with age, but it really is also critically important to reduce depression. And that's something that has impact on cognitive function as well. Okay, so support, and then just the cognitive benefits of socialization, really, I can't stress enough. Relax, reduce stress, really important. There are a number of things that now are very much available in our community that might have seemed a little bit out there maybe 10 or 15 years ago. Meditation, yoga, Tai Chi. And these are activities that people can do that have no physical limitations or that might have significant physical limitations. There's chair yoga. You've probably seen, in your walk around many communities, older folks doing Tai Chi. It can be well adapted to people with various limitations. If you're involved or of interest in religious thought, or if it's been something of your past or something that you want to explore, it can be extremely helpful, not only to reduce your stress, but to also enlarge your social community and to connect with people. And connecting with people almost invariably lower stress levels. It's much easier typically. People are often very stressed by being isolated. And then there's other things like mindfulness, which is similar to meditation and massage therapy. Think how you can manage the stress that exists in your life. And of course, there's always psychotherapy, talking to a professional, especially if you're having depression or significant anxiety. It's one of the things when we do our screening events that, in addition to asking each participant who may be concerned about their brain health or whether or not they have dementia or memory problems, I ask them if they're anxious or depressed, because often those symptoms can mimic dementia. People often have significant trouble concentrating, focusing, become more forgetful. And if we appropriately treat the depression, then some of those cognitive deficits go away. Not saying that everybody who has depression, you may or may not have dementia as well, but it's one of the critical factors that we're going to look at when we make our assessment. So to sort of wrap up a little bit about, this idea of aging healthy, especially with brain function, there's sort of an interactive phenomenon. And, quite frankly, I could talk about this during the question and answer period, but we don't know a lot of what causes dementia and Alzheimer's disease. We know there's a small genetic component, but there are a lot of other theories about why some people develop dementia and others do not. If you want, I can talk about that in the question and answer, but what we want to try to do is maintain healthy lifestyles if we don't have this illness at all, or if we even are in any stage of the illness as well. Decrease your cognition, decreases anxiety. You want to increase memory, decrease insomnia. It decreases depression, increases attention, and decreases stress eating. What's the effect to the pathophysiology of brain disease? You reduce brain inflammation. There've been a lot of new work looking at whether there's an inflammatory process that sets off the Alzheimer's disease process. Some of these behaviors can change brain structure. We've talked about how the effects on blood pressure. People that have high blood pressure are at much higher risk for brain disease because of how vessels change. And we want to watch our heart health because there's a relationship between heart health and brain health. And we do some of these other things. we decrease cortisol levels, which has been associated with high levels of stress and negative effect on brain health. It's a lot to talk about, but you want to try and control your risk factors. The risk of experiencing age-related cognitive decline is influenced by age, genetics, and lifestyle choices. So what that means is the older we get, the more likely that we are to have a possibility of getting Alzheimer's disease or dementia. By the time we're 85 years of age, whether or not we have a family history, there's a 40% chance of having disease. By the time you get to 90, that increases to 50 or 60%. Genetics, they play a role, but they're not the complete determinant. Just like if you have a family member that had breast cancer, you know, as a woman, you'd probably, if your mother or sister had it, you'd be more likely to get or do early testing for that as well. Similarly, for dementia and Alzheimer's disease, you want to be aware of what your family history is, but it doesn't tell the whole story. So, for example, I give the example that if there are two identical twins, they share exactly the same genetic material. One may get the illness, one may not. So we know that genetics are not the entire story for determining who gets Alzheimer's disease or dementia. If we have a first-degree relative, there's about a 15% more increased risk. And lifestyle choices. That's what I've been talking about for the last half hour. Obviously, some risk factors can be controlled through diet, physical activity, and medications, but it is important to get treatment for conditions that increase the risk of cognitive impairment and also help your overall brain health. So if you have other health problems, focus on getting well for those particular conditions as well. Get involved in research. I mean, I'll talk about that. For instance, as I said, we're doing a lot of clinical research for people that have mild, moderate, and severe Alzheimer's disease. We're doing studies to find better medications for the behavioral problems associated with Alzheimer's disease. That would include the paranoia, the agitation, the sleeping disturbances, all those kinds of things. And there's a lot of people, a lot of companies in pharma and the government that are very concerned about our aging population and the increasing risk of Alzheimer's disease. Because we're doing a better job at treating things like cancer and heart disease, people are living longer. But the longer they live, the more likely that they are to have a risk for Alzheimer's disease and dementia. So in addition to the studies that I mentioned, they're also looking at preventative treatments for Alzheimer's. And we're involved with doing PET scans. They're trying to identify what's going on in the brain before symptoms occur. And there's a lot of diagnostic research that's going on to try and do very early diagnosis and preventative treatments. The aspects of research that might be helpful is getting access to potential breakthroughs and treatments. You receive testing, access to some new diagnostic tests, and really you get connected with people that are very expert in dealing with this illness and in memory disorders. And they're not just touching on it in a superficial way. They're seeing lots of patients and are very aware of all the treatments that are out there. And you might even be helping yourself. In addition to the fact that we're really aware of the cost that this disease is taking on in terms of society, how difficult it is for the spouses of somebody that has this illness, for the children, and how lives are so disruptive. So in addition to helping yourself, you're helping families and future people that are going to be affected. I'm not going to talk about the questions you should ask. That's something that, you could talk to anyone about, if that's a consideration. This is my contact information. I'm Dr. Adam Smith. My partner is our two psychiatrists, Mark DeBono, who's a geriatric psychiatrist, and Dr. Schallenberg. And in addition to doing general psychiatry, our focus really is geriatric and memory disorders, Alzheimer's disease. and we are here in Staten Island. My phone number is there for you, as well as access to our website. So I talked a little bit longer than I wanted to. Hopefully some of this has been relevant for you, and I'm really open now to kind of taking any questions that either this raised or something that may not be related to anything I talked about, but is of interest to you.
Thank you, Dr. Smith. That was really great. If anybody has a question, you can put in the Q&A, and I can see the questions and read it for the doctor, if anybody has any questions.
I hope
And
so,
also,
because
the
it's often...
webinar will be available on our website. If you want to review it, and if you miss anything, or if you miss the beginning, so we'll have it already on the website at pssusa.org, so you can go and look it up.
Yeah, I mean, often the things that I talk about aren't necessarily always answers the questions that people have. So
Yes.
that's why I try to keep these things relatively short. But, you know, I guess we started a little late, so.
We have a really good attendance today. We have up to like 15 people.
All right, great. Hopefully somebody has a question.
Yes. If you have any question, or if you want to reach out directly to the doctor, his information will be posted also.
Yeah, I'm happy, look, I'm happy to take questions outside the context of this particular presentation. We're looking really to provide information to people. This is a disease that the average amount of time from having symptoms to diagnosis is 3 years. And so during that time, there's there's a disease process that just continues to roll on. And it's really important to get very early diagnosis and treatment. It drastically changes the course of the illness. And there's a lot of education that needs to go on about this, because primary care still don't focus on this. Families are still hiding it. There's still a stigma. And so I want to make myself available outside. You have my number. My email is smith@rbany.com. And if I can help you get the appropriate treatment, or help you to find someone that can help you make a diagnosis, or, I'm happy to do that.
Okay, so I have 2 questions. The first one, it's from Jen Baker. The question is, what will a geriatric therapist do for someone who is losing speech ability?
Well, so speech ability, right, and I'm not a speech therapist, but, in the process of a dementia or Alzheimer's disease, people's ability to find words and to speak can become impaired. And it varies. Some people do get affected by this, and some people do not. I think the thing to realize is, for those people, you have to try and determine who is impacted by, there's multiple aspects of speech. How much can someone understand versus how much can someone express, right? So it's called receptive and expressive speech. So you want to try and make some assessment of that. But if someone just has trouble getting the words out, it's almost like what's called an apraxia. People with dementia can often have trouble using remote control, or sometimes they'll put the toothpaste on the wrong side of the toothbrush, or have trouble using a comb. They can't get their hands to do what their mind wants the hands to do. And similarly, something can happen with speech, so that people know what they want to say, but somebody with dementia may have they can't get their mouth to speak what their mind wants to say. And in those particular cases, there probably are good alternative means of helping somebody with that. And probably speaking to a speech therapist would be best, but sometimes they'll use boards with pictures, or maybe somebody's able to type, or use some other mechanism to identify what it is that they mean to communicate. I will say that in dealing with people that have dementia and expressive language problems, you want to ask very direct questions. You want to be able to ask questions that they can respond to with yes or no frequently, or in a forced choice way. So, for instance, if you're trying to find out what that person wants for dinner, instead of just asking, hey, what do you want for dinner, which is a fine question to ask if somebody doesn't have a problem expressing themselves, but for somebody that can't, say chicken or beef or vegetables, you often want to provide those choices by saying, hey, you know what, for dinner, do you want chicken or fish? And so you're providing that word to them and giving them a choice at the same time, and you're not requiring them to come up with that word on their own. And frequently, once you say that word directly to the patient, they can then immediately repeat it back to you once they've heard it. It does help facilitate their speech. So there are a number of things that that one can do, but you want to avoid asking very open-ended questions to somebody that has an expressive language problem. How's that for an answer?
I think that's great. The so the next question, she said thank you. The next question is, what research are you doing that we can volunteer on right now?
That we can what?
That the person can volunteer.
Okay, so look, right now we're doing work for people that have what's called mild cognitive impairment. So it's having more of a memory problem than would be typical for your age, but it doesn't meet the standard for having dementia. So if you notice that you're having some more trouble, remembering appointments, but you're basically able to do everything that you normally were able to do, there is this stage that's before dementia, but it's more than part of normal aging, and so it's a very beginning process of having a memory problem. So we're looking at patients like that and seeing if we can administer medicine to see if we can prevent that memory issue from worsening. And then we're also doing work with patients that actually have Alzheimer's disease, even from mild patients to moderate patients, to see if we're working with various organizations to find medicines to slow down the progression of the plaque process that occurs with Alzheimer's disease. During that disease, there's all these plaques that form on the neurons, which are the wires that keep communication flowing in the brain. So there's a lot of organizations and companies that are trying to develop medications to stop that disease process, and we're doing a number of trials for that. Even we're working with Biogen that has something that's fairly promising for that. And then last, we're doing a lot of work with patients that have all stages of Alzheimer's disease to try and have better management of behavioral problems. So one of the biggest complaints we get from families are, my mom, who is so sweet and gentle, now with this disease is angry, short-tempered, doesn't want to take a shower, yells, and doesn't sleep at night, and it causes all sorts of disruption and upset for the patient and the caregivers. And while there are a number of medicines that are out there that do a fairly good job of managing those symptoms, they still have side effects, and not all those medicines work equally effective for everyone. So we're looking at some new things that may have a better outcome, that may work better and may have less side effects. So we're constantly trying to take the medicines that we have, make them better, and for and that's for the behavioral aspects. For the cognitive or memory deficits, that's where we have a lot more work to do, and we are doing 3 research studies to try and address those memory deficits that are that's the other aspect of Alzheimer's disease and dementia. And if people want to call me up or contact me specifically, I can go over those. But what I usually try to do is meet with that person and the family, make some sort of assessment of how that patient's doing, and then talk over the various research options that might be best applicable for them. And just so you know, I mean, we first try medicines that are already FDA approved, but these are often good choices, as some of the medicines, as I said, that are already available just aren't very effective at slowing down the progression of the illness. So the bottom line is we do try to match what's going on with that patient to the appropriate clinical research study. But if we're not doing it here, we're happy to point out other centers as well that might be available. And everybody can go on a website called clinicaltrials.gov. So clinical trials, just as it sounds, one word, .gov. And every clinical trial that's in development and is recruiting patients for is listed. And it's a database that you can search by kind of disease and location, and it'll tell you, what's available in your community. There's a lot of work being done out there, and we need people to get involved, not only for their own potential benefit, but this is how progress gets made.
I have two other questions. The other one is how to convince an wildly memory loss person who won't cooperate. For example, no social, no exercising, etc., etc.
Yeah. It's a big, big, big problem. I mean, I will tell you, as this person probably well knows, the majority of people that have Alzheimer's disease don't think they have a problem at all. So how do you get somebody to do something that's going to help them when they don't think that they have a problem? It's a big issue. And like most difficult issues, there aren't easy solutions, except that we try, to get that person to somebody like us, where we would try and figure out, well, what's the thing that's preventing them from doing things that might be healthier for themselves. So for instance, I have a lot of patients who we think a day program would be a great thing, but they don't want to leave they're scared to leave, their husband, spouse, or child that takes care of them. They're always looking for them around the house, and they're invariably convinced that they would never, go to a day program. Well, we try and look at that, and sometimes we can give them medication to help relax them, reduce some of their anxiety. And, often we can move those patients into those programs. Sometimes it's suspiciousness, sometimes it's paranoia, sometimes it's irritability. So we often have to treat the underlying reason why the person's unwilling to do what is in their best interest. Exercise, what they eat. It's hard to get somebody off the couch if they don't want to move. But the big issue with this disease is you have to be very creative, and sometimes relationships have to shift. The children who may feel very uncomfortable about telling their parent what to do because their parent has always been the parent. Well, sometimes roles have to shift too, and the child needs to become the parent. And I often say, if you wouldn't let your child stay home, your 7 or 8 year old child stay home from school because they didn't want to go, you would find a way to make that happen. And so sometimes it just requires some creative thinking. Sometimes the caregiver needs support, suggestions, and encouragement. But it's not easy, and every case is different. And it's important to connect with support groups, other professionals that might have experience with this, and you have to problem solve. Some things may work for some patients, not for others. But getting a good, reaching out to a lot of people and getting a lot of ideas is often a good solution because, everybody's, somebody else may have been through what you've been through before, and the support groups and other professionals might have very specific ideas about your situation that they've, experienced and learned from. So I encourage, those caregivers to be less isolated, uh, to find other resources. So, and then, I'll also say once you have maybe a potential solution to a problem, it may work for a week and then stop working, and you got to come up with a new idea. So, it's a constantly evolving, changing, uh, scape of behavior that just that keeps you on your toes, frustrated, and always needing to adapt. Caregiving is just about the hardest thing, and doing it alone is just even more difficult. So again, my best answer to a very difficult question that might have, it's really probably many answers, but you're going to get those answers from reaching out, to people about your specific situation.
And the last question is it's about a let me see if I can read it. It says, I understand there are no really effective medication to slow or reverse memory loss.
All right. So you know what? There's two medicines, almost three that are approved. I'll just go through those real quick. Aricept, or is called diazepam. So every medicine has two names, a generic name and a trade name. So one medicine is Aricept, the other and then there's a patch formulation of that Aricept called Exelon, and that's a medicine that keeps a neurotransmitter in the brain called acetylcholine, and it keeps it flowing better. And so it slows down the progression of the illness about 6 to 12 months. And it does that by helping information flow better between the brain neurons. It doesn't do anything about the underlying disease process and disease state of Alzheimer's. So it keeps people functioning about 6 to 12 months on average better than if they didn't take it at all. The other medicine that's approved is called Namenda, or memantine. And that's a medicine that it was initially approved for patients that have more moderate to severe stage illness. They don't know exactly how it works, but it helps people function a little bit better. It doesn't keep the memory necessarily scores improving or stabilizing, but it does help them function more independently. By the way, both those medicines can be given together. They don't interfere with one another. And more recently, they've come out with a combination product. Like sometimes you've seen it for hypertension, but there's a medicine called Nemzeric that's a one pill combination of Aricept and Namenda. So you can get both those medicines in one pill. And that's basically what's approved now to slow down the progression of Alzheimer's disease. And Aricept's probably been out 15 plus years, and Namenda 10. So it's been a long time since we've come out with a new medicine to treat this disease. It's very, research has been very frustrating, but there are a number of efforts that are still going on and are being very aggressively pursued. And so to really, in addition to the kinds of things I've talked about, if one's interested in pharmacology or a medication, getting involved in a clinical trial is the best way to find a potential medicine that may slow down the progression of the illness. I will just say that there have been a number of vitamins and other nutritional supplements that have been studied in the past, including vitamin E, ginkgo biloba, and they have not shown any benefit over placebo. And you also have to be careful with these natural products because, for instance, vitamin E can cause blood thinning, and you have to be aware of what you're taking and how much dosage, and talk about that with your doctor, because just because it's sold in a health food store doesn't mean that it couldn't have some negative medical effects. They've also done research, as I've mentioned, these twin studies from years ago. They looked at identical twins to try and determine which patient got ill and why one didn't. And they looked at the different medicines that those twins were on. Some had been on estrogen-based therapies, some on non-steroidal anti-inflammatories. So there's been some studies of those medicines as well. And again, those have not shown to be beneficial to reduce the incidence of Alzheimer's disease either. So, there's nothing that I can suggest in terms of specific nutritional or other kinds of medications used off-label that have been shown to be beneficial. So, getting back to this brain healthy initiative, don't minimize the importance of those kinds of issues that I've talked about. If you do have early illness, the Aricept Namenda can be considered. And, think about a clinical trial. They're, we're on the forefront of developing these medicines to slow down and stop the progression.
Thank you again, Dr. Smith. So far, we don't have any other questions.
Well, I thank everybody for listening, and hopefully there's been some, value to the information. But if there's anything remaining, I'm here as a resource and happy to, take any calls or answer any questions of interest.
Yes. Again, the webinar will be posted online if you have. Great. You miss anything, if you missed the beginning, and also the information for the doctor will be also posted. Thank you again. It was a pleasure for you to do the webinar for us.
Thank you.
And we'll talk to you soon.
Have a great day, everybody.
Have a great day. Bye-bye.
Bye-bye.